Okay, next up we have Isabella Graham Torres.
Hi everyone. I am 15 and I live in New York, and this is my story. It first happened years ago, so long ago I can't remember how old I was. Young enough that the memories are flashy and hazy and almost non-existent. That's what this memory is like. It was a sunny day. That's one thing I remember. It was cold, too. I pressed my hand against the window to check the weather. My hands were stiff, swollen, double their size. It hurt to move my fingers, and for some reason, it hurt to walk. I opened the door. My mom was there. She said something. She was worried. She called my uncle or maybe her friend. I can't be sure. The memory ends there. That was the first real flare of my life. But I'm not here to talk about my health condition. I'm here to talk about how the medical system failed me time and time again. The day that memory took place, my mom rushed me to a pediatric rheumatologist. Up until then, I had been exhibiting symptoms of some body-related issue. I was a dancer, or as much of a dancer as someone who had yet to hit their coveted double digits could be. And almost every few months, I found myself at another doctor's office complaining of ankle and knee issues. Their answers were always one and the same. I had danced too much that week, and I had a small hairline fracture. I was thrown in a cast and sent home without another thought. They didn't think about my mom's medical history or the countless conditions that could affect a kid my age. Instead, they rushed me out of the office with a prescription for a couple weeks of PT and an excuse letter for dance. If you have my condition and immobilize the compromised joint, it'll stop hurting temporarily. So while in the cast, I felt miraculously better. While these doctors' aid wasn't helpful, we didn't have another option. So I continued to miss dance lessons and endure casts. By the time that hazy memory took place, I had been suffering from my symptoms for roughly 2 years and was desperate for any respite. The next doctor that we went to, an elderly white man, hastily checked my range of motion, where the pain was in my joints, and had me walk around the room. After no further testing or asking me any questions about what I felt, he sat down in his chair and declared that nothing was wrong with me. You didn't even wince. You can't be feeling any pain. Young girls do this, he explained with a wave of a hand. I was bewildered. How could someone decide I was completely fine in less than 10 minutes without any testing whatsoever? Did wincing really count as a method of diagnosis?
Hmm.
Another year went by, and we went to another doctor. I explained my symptoms to her, and after listening, she declared that I probably had lupus. It doesn't matter if I test you, though. You probably have it, but you're too young for any medicine. My mom and I sat in her office, confused yet again. First, nothing was wrong with me. Now, I likely had a serious medical condition, but I was too young for medicine, so I just had to suffer through it. Just a few months passed, and my mom took me to a different pediatric rheumatologist. She was concerned about my symptoms and felt that an answer was needed. Unfortunately, this doctor was equally detached as the others. Have you heard of only child syndrome? It's common in kids your age, she supplied. Only child syndrome doesn't cause inflamed joints, fatigue, or fevers, I thought. But she is a medical professional, I reasoned. I began to convince myself that maybe that was the case and that maybe she was right. Luckily, my mom took me to a different pediatric rheumatologist. She explained that there were plenty of chronic conditions that couldn't be tested for with blood and stayed persistent until she was able to diagnose me. The whole process of my diagnosis journey was tumultuous, to say the least, but I was finally able to find a doctor who paid attention. She listens, and we have communication about what medicine I want to take and how I'm feeling. Despite the happy ending, my life has been irreversibly changed by the poor medical care of the doctors we first visited. Due to their unwillingness to find a diagnosis, I was forced to stop dancing once I was finally diagnosed. By then, I was 13, and dance had become a significant part of my life. My doctor explained that the damage to my joints had gone on too long, and now dancing would be dangerous and painful. I've now found new passion, repaired my relationship with healthcare providers, and am making a point of raising this issue wherever I can, whether it's with friends or in my school newspaper. I believe it's crucial to hold doctors accountable for their mistakes, but also I lead every day grateful for the healthcare system I now have and for the family that fought to get me here. Thank you.
Thank God you had the family. You needed all the help just to get through. It's horrible.
Me too.
Yeah.
Thank you, Isabella. The audience does so much commentary in the chat going on, but thank you so much. That was so powerful. And we really appreciate you being willing to share your story, especially, so early in your healthcare journey, because you will have many encounters moving throughout your life.